Thank you all for coming. I have a few different times on different clocks here, so we'll go ahead and get started. Go ahead and find a seat, make yourself comfortable. You're in for a great session today. So I will welcome you here on behalf of the Aquaya Institute and the Real Water Program of USAID. We have a great lineup. We're going to give you a very quick introduction just to get everybody up to speed, talk about some findings from a report that we recently had out, and then we'll try to do a few movement breaks and panel after that, and then there will be a chance for you all to kind of be part of the action and a fishbowl activity at the end. So my name is Karen Setti. I'm the Senior Manager for Research Translation at Aquaya, and my co-host today is Jeff Albert, the Deputy Director of the Real Water Program. So we're happy to have you, and with that I will turn it over to our colleague from USAID to introduce the program.
Thank you, Karen. Good morning, everybody. My name is Dan Smith. I'm a Water and Sanitation Advisor at the Center for Water Security, Sanitation, and Hygiene at USAID. And it's really a pleasure to welcome you to today's session on emerging trends in rural water management and supporting evidence. And at USAID, we are really thrilled to be funding and even contributing to this program. So I'd like to thank the Real Water Consortium. It's led by the Aquaya Institute, as well as Aguaconsult, who will present findings today, as well as many of the other leaders you're going to hear from, and hopefully will be a vigorous debate in a friendly tone, of course. But what I really wanted to get across is that today's session is really important for USAID at an agency level, because it embodies two of our agency priorities, which are promoting good governance and elevating the use of evidence in our programs. So for USAID, promoting good governance really boils down to strengthening accountable and resilient systems that deliver for people, and that includes rural water customers, who we'll talk about today. So over the next 5 years, USAID has committed to measurably improving the performance of 1,000 water and sanitation institutions in at least 30 countries. And it can include really any type of institution, governments, water resources management agencies, service providers, and civil society organizations. So this is actually one of our 4 global water strategy targets, and it's exciting because it's the first time we've ever had a target for water and sanitation governance at the strategic level. And of course, real water exists to improve the evidence and to improve the application of that evidence to inform USAID's rural water investments, and we hope the investments of other funders, and also the work of you, our colleagues from government, practitioners, the research community, and civil society. So without further ado, I'll pass it over to Jeff.
So I'm just going to say a few words about the Real Water Program so that we can very quickly get into the presentations from our colleagues at Aguaconsult, and a great panel that will consist of folks from USAID, from Uptime, from UDUMA, and from IRC Ethiopia. So we really want this to be as interactive a morning as possible. So just real quickly, Real Water is, as Dan mentioned, funded by USAID. It's a 5-year research program, and it basically has these 3 domain areas. One is on trying to understand what drives the performance of rural water supply systems and the providers that deliver those services. The second area is in water resource management. Third area focuses on water safety. So those are these 3 domain areas. We're just starting year 3 of this program. And this is where currently the project is conducting its research. Ghana is, of course, a really central location where some work that was presented yesterday as a poster by Analia Saker from Aguaconsult, which focuses on an observational study of a large number of rural systems to try to understand what influences their performance. But in addition, we're also doing studies of water safety plans and the effects of water safety plans on performance. Also, we've introduced an innovation that we're really excited about, which is called the Water Quality Assurance Fund. That's being piloted in Ghana, in Kenya, Uganda, and Tanzania. And the idea here is to remove financial barriers to water quality testing by rural suppliers, and to try to understand whether there's an opportunity for that to trigger a series of other impacts. Just the act of removing the financial constraint on water quality testing, whether that can then lead to increased water quality testing, increased confidence by consumers, and ultimately improved performance, including improved water quality. I'm not going to race through the rest of these countries because I really want to get us to our panel discussion. Here are the participants in that discussion, and I'd like to just before we get started. These are the participants in our panel discussion. But prior to the panel discussion, the first thing that we'll be introducing is a presentation on a report that was just made public by the program on emerging trends in rural water management. And Julia Boulnoir and Analia Saker will be doing that presentation. Just some audience discussion instructions before this first presentation. We really want as much interaction over the course of the next hour and a half as possible. So there's a bowl, I believe, in the back of the room. Please, as you're being inspired by the presentation, as you're thinking of different ways of wanting to reaffirm or challenge what's being presented, please, we welcome you to put those questions back there. We'll do our best to use those in our discussion. Please write them clearly. And with that, I'll hand the floor off to our presenters.
Sorry, I'll just a couple quick announcements. If you are participating online, we have Aline Saraiva-Okello helping us to moderate, so feel free to join in if you can see us in the room and you want to follow along. We also wanted to get a quick poll from who's here, and I see the room is full. This is awesome. How many of you are working on rural water, by show of hands? Okay, quite a lot. How many are working on urban? Don't be shy. Great. Any sanitation folks? Okay, so we have an awesome cross-section today. And then in terms of geography, how many of you are coming from the Americas? Okay, anybody working in Asia? How about Africa? Quite a few, awesome. Okay, is there anywhere I missed? Europe? All right, we got a few. Okay, great. So online, if you want to go ahead and put that information in the chat, we're really excited to see who's here. And with that, I will turn it over to Aguaconsult. Thank you.
Thank you, Karen. My name is Julia Boulnoir, and I'm with Aguaconsult. So I'm going to talk to you about a few activities that we conducted as part of the inception phase of the Real Water program on one of the focus areas that Jeff introduced around improving rural water performance. So the objectives of the inception phase were multiple, but mainly we were trying to look at trends globally around rural water management with a view to identify knowledge gaps and ultimately design a research program. As we were doing that, we were also looking for candidate countries where the research would make sense to happen. So with that in mind, our activities were largely around we did a big desk study to look at global trends, but we also wanted to zoom in a number of countries to look at what these trends looked like in these countries in more detail. So we pre-selected 12 countries, looking at USAID's high priority, and strategically aligned countries, and I'll come back to that on how we selected these 12 countries. And for these 12 countries, we developed an analytical framework that guided a document review, so we only looked at secondary sources of information to understand a little bit what was going on and what we already knew, what the sector knew about management arrangements. In parallel, we did an e-consultation. We got over 400 responses because we wanted to validate some of these global findings and country findings with practitioners' perspectives. And these findings are summarized in this report, but I just wanted to say that that was one of several activities in the inception phase. So just a word on the country selection. As I said, we started looking at USAID's high priority, and strategically aligned country list. But we wanted to pick 12 countries. So the way we did that was we started with the core consortium partner countries. So that was Kenya, Uganda, Tanzania, and India. And then we looked for 7 others. And the way we chose them was we wanted a variety of rural water coverage, different levels of income. We wanted some regional representation, but we also wanted, and as importantly, countries where there was potential to learn from a variety of management arrangements. So this is the typology that USAID uses, and as you can see, the countries we selected there's a wide range of management arrangements. There's a few that aren't covered or not as much, but that's how we came up with our 12 countries. And so when these were selected, we developed an analytical framework which looked at over 100 parameters. And the idea was to see what evidence, what information was out there that enabled us to describe and characterize the management arrangements for rural water provision in these 12 countries. So looking at what's out there, what are the gaps, do we know about the context of application, the institutional and legal arrangement of these management arrangements, is there evidence of the technical capacity, financial capacity, regulatory arrangement, practices around water resource management, water safety management, transparency and participation towards users and local government, and the performance in terms of the quality of service that is actually delivered. And so the key results were not surprising. So they largely confirmed what we had found in the global desk study. In the 12 countries, community-based management remained the predominant arrangement for rural water management, but in all 12 countries, or almost, the government was diversifying its approaches to rural water management in different ways, largely through utility provision or by bringing in the private sector, and I'll come back to that, or by supporting communities more deliberately. In most countries, there were efforts underway to strengthen regulation, I'll come back to that as well, and to consolidate services to achieve economies of scale. Again, it takes different forms in different countries. But one very important finding we got was there was actually very limited evidence of the performance of these different arrangements at an aggregate level in each country. So the evidence we had was very patchy, and that informed our research design. And I'd like to maybe now hand over to Analia, who's going to tell us how these findings informed the research design in Ghana.
Thank you, Julia. So again, I'm Analia Sacker. I'm a water and sanitation specialist at Aguaconsult. And based on what Julia mentioned, we found this gap in the literature in which there wasn't evidence to guide the decision-making towards diversifying management arrangements in these countries. So we wanted to understand what actually is behind, so up until this moment, what we saw is that this decision-making was based more on the lack of success rather than on hard evidence. So that's why we wanted to know which type of management arrangement actually worked. So we started our research in Ghana, and we decided to start in Ghana because Ghana has 3 types of management arrangements in rural areas: supported CBM, safe water enterprises, which are private companies that are supported by international donors, such as Safe Water Network, Water4, Project Magi, and public sector provision, which in this case is TWSA. And in Ghana, this research was particularly relevant because Ghana is currently undergoing reform. So we hope that the findings of this research will help guide that decision-making. And I'm not going to talk a lot about this because the session today is about consolidation and emerging trends and other topics. But what we wanted to know was what was the actual difference in performance between this management arrangement and what was behind this difference in performance. So we are at a stage in which we already finalized data collection. We evaluated 150 facilities across 8 regions in Ghana. And we, as well as doing these surveys, like we also did surveys at the district assembly level, and we collected practices at the national level. So this is a research that, let's say, captures the whole system at the service provider, service authority, and national level. But yeah, what are the stage in which we've already finalized data collection, we've started the analysis, and we've reached preliminary results. And if you have any doubts about what we found, you can find me later after this session, and I'm happy to have a chat about it. So thanks a lot.
Okay, do we have some questions for, oh, you have another slide there? Please, oh, okay.
Okay. I mean, I can also talk to it when we get questions, but this was just to maybe go a little bit more in depth on some of the trends that we found around, yeah, so I mentioned lots of countries are actually moving towards bringing in the private sector. They're doing that in different ways. When we say private sector, we mean delegating functions around O&M to a legally registered entity. And so we found examples of this that look different in different countries, with 4 countries essentially that had that at scale. So that was Mali, Mozambique, Rwanda, and Senegal. What we saw in terms of difference is countries where essentially private management has been set as the norm. So this is the way in which the government sees the future for rural water management. So that was examples in Rwanda and Senegal, and other countries like Mozambique and Mali, where it was more bounded to specific contexts. Another trend that we saw was around public service provision, and again we saw some differences with countries municipalizing provision in Peru and the Philippines and India, but also other countries that were setting up a public utility to manage rural water services. And so we're seeing that in many places like Ghana, Uganda, Tanzania, and then consolidation, of course, but I think we'll get into that a bit later. And I just wanted to mention something around regulation, because I think that's a consistent weakness that we've seen across the countries, and that's been reiterated in several studies. But we're also seeing many efforts to actually strengthen regulation, again, in different ways. And I think maybe 2 main ways. One is countries that are expanding the mandate of an existing regulator that is regulating the urban sector, expanding into rural areas. So an example of that is in Peru, in Mali, in Kenya, and in Zambia. But there are other countries where they've decided to set up a regulator specifically for the rural sector. So that's the case in Senegal and in Tanzania, for example. And then finally, there were countries where much more limited progress on strengthening regulation was seen. So that was the case, for example, in Ghana and the Philippines, where the vision for regulating rural water services was still in flux, and there wasn't a clear way forward. And maybe I'll stop there, and we can come back to these points later in the discussion.
Sure. Thank you, Juliet. How are we doing? Yeah. Before we get to our panel, so questions for our folks from Aguaconsult. We have a couple of minutes.
Sorry, and I forgot to add the instruction. If you want to ask a question, if you could please use the microphone in the middle. Do you want to ask a question?
So you had mentioned consolidation And one of the themes of your report was this pattern from that was centralization, decentralization, re-centralization. And perhaps if you want to speak to sort of how and where you see that pattern emerging.
Yeah, sure. I mean, I think, again, the historical arc that I think Harold talked about yesterday in the session, and I see many faces. People are probably hearing the same thing again, but anyway, I'll repeat it. I think it's this move from central provision to community provision historically, and then the recognition that this has lots of limitations, and the move towards re-centralizing for reasons of economies of scale. So that's the process we were referring to. There are words around, is it consolidation, aggregation, regionalization? We can go into discussions of what words means what, but essentially it means grouping services at a scale that makes the most sense from an economic sense. So that's what we meant.
And obviously these patterns are geographically specific, and what we'll invite you to be discussing both in the panel discussion, but also when we have our fishbowl towards the end is what we see the evidence leading us to in terms of whether re-centralization or decentralization drives superior performance.
All right, last chance. Any brave souls have a question?
Please.
We have one. Bashir. All right, go
Hi,
ahead.
thank you. My name is John Allen from Water for Good. First of all, fantastic work as usual, so congratulations on all the work you did to finish this research paper. My question is around financial incentives, and if you noticed any trends changing in that, because I would say historically the majority of funding incentives do not focus around professionalization of service delivery or even preventative maintenance or things like that. Are you starting to see trends shifting in terms of financial incentives around that? Or are these trends more happening organically without funding being an incentive towards that?
Yeah, thank you, John. I think we're seeing these trends happening for reasons that aren't necessarily driven by financial incentives. We're seeing that I think the drive is mostly around non-performance, driving the search for alternatives, but we're also seeing in parallel some mechanisms that you're very well aware of, such as Uptime, that does reward performance and is a financial incentive to performance. But I wouldn't say that that's been the key driver. I'd say it's more the failure of existing systems that is driving the diversification.
Yeah, great question. Thank you. And I just wanted to put this up one more time. If you get a chance to read the report, there's some really interesting things in there. And as Julia mentioned, this is part of kind of a suite of products. There's also a brief specifically about consolidation. And another one that's talking about water safety planning efforts in Ghana, which is something we'll get into later. So all of our resources are at this globalwaters.org site, and yeah, feel free to check it out. And thank you all again. So we have one more quick movement break. Keep your blood flowing here. Just by show of hands again, how many of you, now that you've kind of heard a little bit about these topics, we're going to get into more, are thinking, you know, this method of supporting community-based management sounds really intriguing to me. I'd really like to see where that goes. Just show of hands. Anybody interested in hearing more about that? Okay. How about professionalization? How many of you are kind of like, oh, that sounds kind of cool? Okay. A few more. Great. How about results-based funding? Anybody really like interested in the finance side? Okay, great. Public-private partnerships or delegation models where the public entity might be delegating the service operation to a private. A few? Yeah. No shame, be proud. All right, re-centralization, bringing things back to a central entity maybe after that. We got one strong in the back. All right. So this is maybe after things have been decentralized and they're coming back because maybe, as Julia pointed out, it wasn't working well. Water safety planning, Jeff mentioned some studies on this, doing kind of risk-based approaches to managing water systems, rural water systems. A few, nice, okay, that's mine. Okay, consolidation or aggregation, grouping things under umbrellas. Way of maybe having data sharing, common oversight. And then decentralization, localization, we got a few. Okay, so there's interest in all of these. Maybe some might work in different contexts. Some might work better in other contexts. So to explore that more, I'm gonna go ahead and introduce our panel. And I'll ask you all to come and sit in these lovely seats in the front here. If you wanna come up, let myself. We have a little bit of a maze in the room to get around, but we'll work with it. All right, so the first thing we want to do is just define these terms a little bit better, because we know the definitions can change year to year. Different people might have different interpretations of what we're talking about. So I'll go ahead and let the speakers kind of just define what is this thing they're talking about and what would be kind of their headline statement about it that they want you to know about. So we can start on this end with Michael Dupuis from UDUMA, and he's going to be representing the topic of public-private partnerships.
Yeah, so it's a big room with a lot of people. Hello, everybody. So I'm representing in the UDUMA. We are a private operator. So by what we do and being a private company, we do fall under the private and public approaches. It's a new trend that we are trying to push, support, develop in various countries. Do I present what we do? As a
Yeah, sorry, everyone has to keep their responses under 1 minute, so we keep everything moving within that limit.
It's a
Go ahead.
utility model for rural areas. So it's off-grid water from isolated to peri-urban. We deal with all sorts of infrastructure in the rural sector, from the hand pumps to the water pipe systems. We are fully private, as I said, and we deal only with official contracts. It is very important to mention that. And we are operating in 4 countries. We are not operating in Kenya. We are not operating in Uganda. We are not operating in Ethiopia. We are not operating in Ghana, but Burkina Faso, Mali, Ivory Coast, and Benin. Thank you.
Thanks. A little bit of a francophone presence. And next we have Valerie Baza representing water safety plans.
Yeah, thanks. So a water safety plan is basically a systematic approach to risk assessment and management that a water system can use to ensure the safety of their water supplies. So it involves kind of identifying all of the hazards and control measures at key points throughout the whole water system and the water supply chain, from the water source all the way to the point of distribution, and sometimes to the point of collection as well. And recently there's been a lot of increasing interest of integrating climate resilience into this process as well. So to try to use it also to improve climate resilience along kind of all of the steps of the water supply chain.
Thank you. And Valerie's from the Aquaya Institute, working on real water. And next we have James Winter from USAID, and he's going to be representing on-premises connections, so I'll let him explain what that means.
Hi, everyone. My name is James Winter. I am the avatar for on-premises water connections. This is a proxy for how accessible the water is, bringing it on-premises into your yard, perhaps into the yard of a neighbor in a shared system like that. These networks, we typically conceive them as water supply networks that are using reticulated networks and reticulated pipes to deliver gravity-fed piped water that's powered by maybe solar power or grid electricity to pump this water into a storage tank before delivering it to users. From my perspective, this is becoming more popular, especially after some of the findings from the Wash Benefits and Shine studies, to try and move water security and water access into a higher tier. And so something that I think is well characterized or better characterized from a relative sense right now is the benefits of moving water sources from, say, 200 meters down to 10 meters away from the household. However, something I'd like to talk about later in the panel is how we're characterizing the costs of this, whether from the operational expenses that are being borne by users or the capital expenditures or the costs of finance to install these, because they do have substantially higher capital expenditures. So I'll pause there.
Thanks, James. And next we have Dan Smith, also from USAID, representing professionalization.
All right, so I'll start by offering a 3-point definition of professionalization or professional services. They should have people who have extensive and specialized training delivering them, who are working full-time in exchange for money, and who are accountable to defined standards of conduct and technical quality. And so professionalization is just the process by which a service acquires those hallmarks. And what I'm trying to do here is define professionalization in a way that can accommodate various pathways to getting there. So it's not only about maybe the most common case in our sector, which is community-based management becoming more professionalized, but there are other ways we can accomplish this goal. It could be strengthening government's support to rural water providers, strengthening the workforce in various ways, and even reforming regulations to incentivize more professional services. So I think those all count as professionalization, and USAID's programs are supportive of the ones that are going to work in specific contexts.
Thanks. So next we have Lemessa Makonta from IRC Ethiopia, and he's going to be representing the consolidation topic.
Thank you. Improving and sustaining rural water services is the approach is context specific. One size fits for all approach doesn't work. Along the spectrum of centralized services and the decentralized services, which are the two extremes, we can find a proportion or a mix of different models. In the well-established utility, which is more centralized on one extreme, and on the other extreme, at household level, which is self-supply. Between these two, we can find an example of consolidation, for example, which is used to overcome financial challenges and the technical challenges. Of course, there is other aspect of consolidation. In most places, it is called clustering. Even the terminology consolidation, especially in my country, it is new. It is known by clustering. The other aspect of using consolidation is to settle or to harmonize urban-rural relationships, because for most urban centers, rural water supply is coming from, urban water supply is coming from rural areas. And sometimes there is a friction between the two. So consolidation or extending the urban utilities to embrace the rural area really settles the conflict between the two. This is the third aspect of consolidation. So overall, it is about like clustering services. Even if we are not sure what do we mean by centralization, is it at administrative level, geographic level, or population size? Is still open for discussion. Thank you.
Thanks, Lemessa. And last but not least, we have Andrew Armstrong from Uptime, and he is going to be talking about results-based funding.
Hi, everyone. Good morning. So broadly, we throw this word results-based funding around. Broadly, what results-based funding is, it's when payments are made for outcomes that have been verified. I work with a company called Uptime, and we are applying this principle with governments and service providers to reward performance and address financial sustainability gaps. Service providers report to us on quarterly performance, and then they qualify for results-based payments. So my headline, I wrote it down so I would get it very clearly, but it's that key performance indicators, the right key performance indicators, we believe can incentivize sustainable and equitable outcomes, specifically in our case for rural water supply.
Thank you. So with that introduction, we're using this term emerging trends. I wanted to ask, are these really emerging trends? How new are they, or how well established are they? And Dan, if you don't mind going first for professionalization.
Sure. Well, I think professionalization isn't new itself, but it's really emerged recently and is getting a lot more airtime, as we can hear right now in our session, which I think is really coming from the sector grappling for how to maintain infrastructure that's already there and for attaining the higher standards that are set by the SDG 6 goal. So it's really been heartening to see the increase, even though I'd say it's still relatively small in the literature, of this attention to professionalization. And I'm really happy that USAID is supporting it through this program, as well as our implementation programs. And as I mentioned before, professionalization isn't about one kind of service delivery model, right? That's kind of my main point. It can be various ways to get to the same desired outcome. So, we have examples in USAID of supporting municipal offices, like in Guatemala and in Ecuador. We have examples where we support professionalized service providers, work with communities, such as in Uganda. And they're just different ways to get to that same outcome that I defined before as professionalization in the broader sense, achieving those hallmarks, but not necessarily following the exact same path everywhere.
Thanks. And we have a request just to use the microphones a little bit closer so the folks online and the folks in the back can hear well. So I want to pose the same question, Lamesa, for consolidation. How emerging is this trend?
Thank you. Again, the terminology could be new, but the practice is not new. The practice, especially coming to clustering, it has been there for some time. What still could be new is we are not sure how effectively this clustering would work best, and also under what context, which is still open for further research and discussion. Thank you.
Thanks. Yeah, that's a precursor to something else I'll be asking. And then Valerie, for water safety plans.
Yes, thanks. I think in general, water safety plans are quite well established within the sector, particularly for urban systems and a lot of water systems in high income countries. And I think sort of what's been emerging maybe as a trend in the past few years is an interest in using them for more of these smaller rural water systems in Africa and other more low-income settings. And I think we're still learning maybe what the best approach is for that, and some of if it's beneficial or how to adapt some of the water safety plans that have been very well established for maybe some of these areas where they're not quite as well established yet.
Okay, so thanks. A lot of coming up about scale up, kind of specificity to place, whether things, might work well at a smaller scale or might work only at a larger scale. All right, so our next question is, what are the main benefits and drawbacks of these trends? So there, I think in all situations, are two sides of the coin. And Andrew, I wanted to start with you for results-based funding.
And one of the things, even just as I'm listening to everyone speaking, that I think is important to clarify is that results-based funding can really piggyback on and in some ways is dependent on a lot of these other trends that we're talking about, professionalization and consolidation and even water safety planning. Results-based funding can be used to drive these, but in some ways some of the drawbacks is that it's dependent on some of these trends happening. So two key benefits of results-based funding that I want to highlight. The first is that because with results-based funding or results-based financing, payments are made based on outcomes that have already been achieved and they've been verified, it really minimizes the risk of how you manage your investment. So your outcomes have already been delivered, right? So you're guaranteed sustainability or whatever your outcome is based around. So that's one benefit. The other benefit is around this idea of aggregation and consolidation. So because at Uptime we are applying this and having standardized key performance indicators, it allows us to work with many different service providers, many of whom are in the room. We can consolidate those services that sort of on John came up and mentioned a few minutes ago that how do we incentivize operation maintenance? Well, with one service provider, you might not have much of an investment case because the costs are low or it doesn't make much sense. But when you aggregate these service providers together, under a common framework, then you can have a much bigger investment case for funders to apply to. Some of the risks I mentioned, it's dependent, it's not actually a drawback, it's more of just a caution. For results-based funding to apply, you have to have professionalized water service providers who have good data systems and can prove the outcomes that they've delivered. So that's a limitation to the Uptime model in particular is how big can we go, because we need good service providers. And so part of that is that we also need, in order for results-based funding to work at scale, at sort of any kind of scale, whether it's within one nation or across countries, you need an enabling environment, and in many ways it needs to be government-led. And I think that's all that I wanted to say in my 1 minute.
Thanks. And yeah, we're getting a technology tutorial, so if you don't mind just pulling the microphones out of the stand and passing them so they can get like kind of straight on directly near your mouth. I guess that's how they will work the best. All right, and then let's see, Michaela, if you don't mind going next, what are the main benefits and drawbacks of doing public-private partnerships?
Well, in terms of benefits, it's loud.
We got it now.
It's working. So the first one, very clearly, it guarantees sustainability, very important, of services, and bring professionalization at scale. The second one I would put, it can overcome the limited implementing capacity of countries. Money alone cannot make the impact that we wish to have. And the third one is that PPP reduces the government expenditure. Of course, when there is the initial investment, if you have co-investment, then you reduce the price of the investment. But the most important one for me is to avoid recurrent rehabilitations, where countries have to repay for projects they have paid 5 years ago because they have to rehabilitate. And if you put this in line, it's huge amounts of money that they can avoid spending on rehabilitation and focus on new infrastructure to follow the population growth that they are facing. Now on the drawback side would be, of course, he mentioned it, the necessary enabling environment, regulation, institutional framework, but also the policy implementation capacity. It's not only the theory, you have to be able to enforce it in the field. So it lies into several points: contract, delegation contracts, clear roles and responsibilities, clear perimeters for two important points. One, the economy of scale, to make sure there is consolidation and that the operators can make profit out of it. And the second one is cross-subsidy. Within one area perimeter, some will be profitable, some water pipe system, but little hand pumps will not be. But you want to cover everybody and supply services to everyone. So this cross-subsidy thing is important. Consistent tax policies. We are, as private, we are confronted to taxes, and I'm very happy to share that with everybody because this is really a reality. And last one is the predictable tariff adjustment, considering inflation, volatile oil price. How come the price of water is not moving while everything is getting more expensive? On the drawbacks, the second one would be requires authority to change from a project perspective as an implementer to a role of facilitator between all the stakeholders. And lastly, and probably one of the most important at this stage would be the risk. De-risking mechanisms are really necessary to unleash investment and the huge potential of entrepreneurial forces. I mean, I am in the US, you know what I'm talking about.
Right, thank you. And I think, James, we'll take one more from you on this question. What are the main benefits and drawbacks of on-premises connections? And I think what we're hearing is there's a lot of contextual factors that go into making these things work, aside from just saying, yes, they work, or no, they don't work. So.
Yeah, thanks, Karen. Is it all right if I ask Andrew a follow-up question?
Sure.
Great answer, Andrew. But something that I'm always thinking about with results-based financing, and the reason I didn't raise my hand immediately, Karen, when you put it up on the screen at the beginning, was what is the monitoring evaluation load that that comes with results-based financing? Like, who is the person who is taking on the responsibility of verifying all of this in order to get the financing mobilized?
I'll be very brief in my response. So I can only speak from Uptime's perspective. From what we've done is we're trying to build key performance indicators that are common across all service providers, so it's operational data that they're already collecting. I think Michael could probably hopefully validate the statement that they're not having to collect any additional information to qualify for the type of funding that we facilitate. But then all of the validation and verification work is an important piece. So that's like aggregating the data and then making sure that it's, you know, representing something that's actually happening on the ground. That's what we do at Uptime. And I hopefully a lot of our funding partners in the room, and they would agree with this also, that our costs are pretty low for that as well. So it all depends on the key performance indicators, right? And making sure that you've designed those well, and so that you're not disincentivizing or maybe causing service providers to be complacent because they're just doing work and now getting funding and not having to be more scale their services or be more efficient in their services. And so I think it all comes down to the design of the indicators.
Great, thanks. And so then returning to on-premises, thanks, Andrew. I think the benefits of on-premises water come down into three main categories. They're around time savings, productive use, and then health and well-being broadly defined. On the time savings, when you move something radically closer to the home, yes, perhaps they're going to fetch more frequently, more times per day, but the number of minutes that they spend on each fetching trip is going to be dramatically reduced. In the research that I did during my PhD in rural Zambia, we found 80% reductions in time spent fetching water per day. As you can imagine, most of those accrued to women and girls, although that would be contextually relevant. On the productive use side, what we're looking at here is industries or economic opportunities that rely on the inputs of time and water specifically. So hypothetically, this will depend, of course, on access to markets, access to raw materials, access to know-how, but we're thinking about things like juice making, brick making, or vegetable gardens, fruit tree cultivation, things like that. And again, speaking from my own experiences in Zambia, in the treatment group, those that received access to on-premises water had 4.4 times higher odds of cultivating a garden. Their kitchen gardens were twice as large. And they ended up growing things like tomato and okra and green vegetables, things that from a dietary diversity and micronutrient perspective, I think we would all support. From the health and well-being side, I think this is still something that I clearly am hesitating to talk about with really clear terms. I think in the aftermath of WASH benefits, speaking for myself, I became a little gun-shy about talking about really the strong linear growth or strong diarrheal disease reductions that came from household WASH interventions. However, at the same time, I think some of the emerging research, there was a Waddington paper published in PLOS Med this year that was very impactful for me, that was looking at child mortality as a result of different WASH interventions. And so I think that some of our priors are aligning with what we're seeing in larger meta-analyses and systematic reviews about the health impacts for children of improvements in WASH access. And then I think Sarah Young's work on the HWISE index has been very impactful for me in looking at the psychosocial and mental health impacts of really large improvements in water access. Moving to the costs, I think that we can anticipate that there are going to be higher CapEx as well as operational expenditures that result from increasing the service quality. I think there's going to be a willingness to pay for higher levels of service, but also the payment rates are going to have to increase as well. So this comes with a requirement for more intensive governance systems. It becomes a little bit harder to support with a purely community management model if you believe that pure community management was working prior to that. But it's going to require something more substantial, in my opinion, if we're going to get to the payment rates and the payment amounts that will support the installation and operational expenditures that are associated with these. And finally, I'll conclude by saying that there's a lot of research from USAID that's being funded through Aquaya, through the great work of Aquaya, that is looking at a 3-country study that is trying to quantify and characterize the life cycle costs and benefits of piped water services or on-premises piped water services in Ghana, Zambia, and India. So we're really looking forward to learning more about these costs and how to characterize them in the future.
Thanks. So yeah, that's a great segue. Another thing we wanted to talk about is not just kind of what effect does this have on the people managing the water system, but what are the broader impacts on community equity, for example. So that's a great segue. Dan, would you mind maybe starting on that one? And then if anyone has questions in the room, if you want to step up to the microphone, we'll try to take those as well.
Sure, thanks. And to build on the prior answers from the panel, I'll try to say something that's maybe a little more controversial, but I think that professionalization, as much as we support it from USAID's perspective, it's a long-term trajectory. It has the potential to be a double-edged sword when it comes to equity because it's going to cost more than what people are used to paying for community-based management. So I think we've touched on that a little bit with piped water, for results-based financing, maybe the extra cost of monitoring or other aspects that come with professionalization that are not in a traditional community-based management model. And I think that's really important. We're talking about up to an order of magnitude more cost, at least based on evidence that I produced in Uganda, as well as a very diverse setting in upstate New York. Greg Pierce, I'm looking, he had a paper recently about the Thousand Islands area. It was really interesting for me to see how there was a really big improvement in user satisfaction with professionalization. There can be big improvements in water quality and reliability. Like, we know that. I think it's been well established, but we have to figure out how to pay for it, right? So it's a bit of an elephant in the room. Maybe it's not too, it's pretty obvious, but we really have to focus in on that. And I think from a funder's perspective at USAID, we want to kind of make a call to really focus in on that in our research and our implementation programs and really figure out how to do it going forward.
Thanks. Andrew, same question?
Sure. And I'll try to build on that, actually, because so the question is, how does results-based funding, how does it lead to more equitable outcomes, right? How do we think about results-based funding and how it influences equitability? So the last mile populations cost more to deliver same service level to them, right? Even we all agree that this trend towards more professionalization, more enterprising approaches that are looking to recover all their costs with user payments is a good thing. But what that tends to do is it drives the service providers to the areas that are financially viable, and the last mile communities are even more last mile left behind, right? And so what we are trying to do with results-based funding is to see how we can actually free up service providers to deliver the same level of services to those kind of remote areas, while also not disincentivizing them to be more efficient in how they are delivering their services. And so that's what I think results-based funding can play in this space. So some good examples of this. We have people working in very remote rural areas, remote rural communities. But there's also a program called Safe Pani, and and I work with a lot of British people, and my American accent always kind of gets lost. But so Safe Pani is a program in Bangladesh where results-based funding is being applied to deliver services in healthcare facilities and schools that would normally be left behind. And so I think this if you design the incentives right, so that you're not causing complacency, you can use smart subsidies to serve last mile populations.
Thanks. And Lamessa, I'll ask you to take that question as well. And we also have a submission from the online audience. In particular, I think this falls within the category of equity, but how do customers then have an opportunity to provide feedback and provide some accountability when these changes occur in their rural water system? So generally equity, and then specifically customer accountability to customers.
Thank you. Again, I need to link to consolidation or clustering. We do it not because we like it. We don't do it not because we don't like it, but it is the context that really forces us to do it. Which means for population segment, which we can't address through normal, let me say normal utility approach or other management approach, it is a gap filler. We use that clustering just by overcoming financial constraints through cross-subsidizing between or among different users, and also by overcoming technical gaps. So if it helps us to address those population segments, definitely it means we are addressing equity issue in one aspect. So as long as, at least with the current understanding, this is one approach which we have to embrace. Maybe in the future, as we have already seen, how it has been evolved gradually, we may come up with other management model, but with the current understanding, it is the right gap filler to address equity issue. Thank you.
Thanks. All right, anyone in the room want to jump in? We have one from Katrina. Thank you.
Hi, Katrina Charles from the University of Oxford. I wanted to pick up on the point around cost because Dan and James, you've both raised, how much the extra cost is here in terms of capex for on-premises or in terms of professionalization. But as Michaela's pointed out, then it's also partly about making value for money in terms of the investments that are being made in infrastructure and making it continue. How do we shift the sector to allow money to flow towards the operation and maintenance and maintaining and sustaining these services rather than just those investments in the capital, which has been so traditionally where most of the financing has gone?
Yeah, we're chatting about a joint response here. So thank you for the question. I think that's like the question that motivated a lot of my research before I came to USAID, and I'm happy to find that within USAID and the Center for Water, that's a question we grapple with all the time. So one thing that we can do, I'll speak first from USAID perspective, then more generally, is we can write it into our programs, right? Into our program cycle to stimulate more governance. Like I mentioned in my opening remarks, that's our number one strategic objective, to work on that governance, enabling environment, various terms for a little bit different things, but we want to work on, let's say, helping the utilities to manage their assets better, rather than helping them put in more pipes. Right? That's what we're aiming for, and hopefully other funders and governments who have, and multilateral banks who have even more funding can do. I think more generally, the one way of getting kind of stimulating more operation and maintenance investment is to start by providing those better services, and then people can, instead of being unwilling to pay for poor services, they'll be more willing to pay for better services. But there needs to be that spark or that catalyst to make that happen. So I think that's a little bit hand-wavy, but there are examples that are happening from some of our panelists and other organizations that are trying to do that. But also, if we want to keep it real, Jeff, Real Water likes to keep it real. I also wanted to point out, as a kind of a way to conclude this question, is a really interesting finding from the Aguaconsult study was that I think it was 85% of rural water services are still community-based management. Is that right? In the countries you studied. So what we're talking about here is 15% or maybe less of rural service provision in low and middle income countries. So we're really kind of on the forefront here of the thinking and the implementation, but we have to keep in mind that traditional community-based management is still the most common service provision that we have.
Thanks, Dan. And very briefly, I want to leave room for other questions. I think two pieces. One, I think there's a little bit of a fallacy about a low willingness to pay in rural communities for improvements in water access. What I have seen in different USAID programs and my own work is that when there are improvements in service quality, the rates of payment tend to increase commensurately. Something that I was looking at some data from that Aquaya had sent me in preparation for this panel earlier this morning, and rates of payment for community boreholes in the communities in Ghana was somewhere in the 25 to 40% range, and those that had already transitioned to on-premises were over 90%. So in terms of the willingness to pay, I think that there has been a little bit of an assumption that they weren't ready to transition to that level, and I think that that may be one of the myths that we need to confront.
Okay. Andrew, real quick?
Yeah, just briefly, I just wanted to say that when investments in infrastructure are being made, that's also a good time to put in place policies for how that infrastructure is going to be taken care of. And an example that came to mind is in India, all this investment going into piped water into every home in India. Many states, at least the states that I've worked in, have these kinds of measures in place, at least in theory, how they're going to continue to subsidize and have even results-based funding sort of approaches in supporting ongoing operation and maintenance. And so that's, if we can't sort of start focusing on operation and maintenance from the very beginning, at least when new infrastructure investments are going in, you can plan for that in the future. And I think that's the key leverage point.
Thanks. So we're running out of time for the panel. We want to move on to the group activity. But Valerie, if you don't mind, if I could ask you just one more. It seems like in some cases here we're getting into an if-then statement. If these conditions exist, then you might expect benefits. Is that something that's true for water safety plans, or is there no if statement?
You mean, so for example, like if there's something that needs to be true for water safety plans to provide benefits?
Yeah, preconditions, we can call them.
Sure. Yeah, I mean, I think in general, probably, all water systems probably can achieve some benefit from a water safety plan, as it's just intended to improve the water safety within the system. But when you go through the whole comprehensive process of, water safety plan, it can be quite intensive depending on how detailed the process is. And so, while I think that there can be benefit for all systems, part of Real Water, we're doing an evaluation study of the benefits of kind of that comprehensive plan for real water systems to see if the benefits are cost effective, or if there could be other approaches to achieve those benefits, or if the benefits we expect will truly be achieved in that context. So I think that process can be beneficial all around, but we're still kind of learning, if there's specific context things that will be necessary, say, in these rural water systems to achieve specific benefits.
Right. Thanks. And I love that we're getting into this discussion of the evidence now. That was the whole point of the session, I think, is, once you have this concept that maybe works in theory, what's the evidence that you can then bring in to support using it in other places? So a round of applause for our panelists. Thank you all so much. And I will turn it over to Jeff.
Okay, so this is the big audience participation part of the agenda. So we have here 4 chairs, and I'd like to invite some volunteers who pre-volunteered. Don't worry, Louis. Not thinking about you. So please, Antoinette Combe from SNP, the head of WASH at SNP. Carly Olenek from the Hilton Foundation. Oh, yes. Oh, thanks. I'd also like to invite Professor Kwabena Nyarko, the Provost of Engineering from Kwame Nkrumah University of Science and Technology. And who else did we have? Is Nari Ramanarivo here from USAID, Madagascar. Excellent. And Liz Jordan, I'm going to ask you to the first to tap in, yeah? Okay, so the way this works is any question you have, any affirmation of anything that you've seen, any gap that you feel like wasn't addressed, please raise it. Anyone who, once anyone in the fishbowl has said something, then they are eligible to be tapped out by anyone else in the room. Okay, so this is how this works. It's, there's, yes, thanks for, or we can also be passing the mics. Do we have enough mics? Yeah, if you're done. I'm going to be done. Okay, so with that, I'm going to ask Antoinette if you're interested in starting us off. Yeah? Yes. Anything. So any question you have about anything that was presented over the course of the last hour, any gripe, any thumbs up or down, etc. We're looking for respectful provocation here. Okay? Please, go ahead. Thanks, Antoinette.
All right. I'm doubting between two things, but what I'm incredibly interested in is the outcomes of the life cycle study on on-premise, life cycle cost study on on-premise water supply. Because when we're looking at water supply, rural water supply investment, there's always the trade-off of lower service levels for more communities and higher service levels for fewer communities. But we don't have the data to look at that over time. What if this study on life cycle costs of on-premise services would find out that actually it's more cost effective to invest in fewer communities on-premise? That would be super exciting. Or is that wishful thinking? It's maybe not provocative enough. All right, I'll go with my other topic. My other point is that maybe this whole discussion about management arrangements is a bit beyond the point. It's nice to look at the variations of management arrangements, but what really matters is the incentives, not only financial, but the broader set of incentives and the checks of balances around it. And if we think too narrowly on it is this management arrangement that is giving this performance, then maybe we're missing the point.
Agreed. Simply because there may be different management arrangements which may work under different contexts. And each management arrangement may have its accountability mechanisms and incentives to make it deliver. Some management arrangements may have in more private sector, and that could generate some efficiencies. And if it's purely community or government, it may also have some limitations. In some cases, especially where I come from, there may be issues related to interference, could be political interference, and that opens the door to the big question of political economy, which is also relevant for rural water supply. So I agree there may be different arrangements and they may work in different contexts. So even in a particular country, you may have to deal with different management arrangements which may suit different conditions in the country.
So I would say yes and. I agree that we're going to have a combination. I mean, as we've heard from all of these panelists we're going to have a combination meeting different needs of different communities. But once we get to that regulatory piece, how are governments managing these agreements, how are they regulating some of these pieces, I do think the approaches to management need to influence how that happens. And so it's not completely out of the scope of what's important for me to figure out how we best support governments to regulate and governments to manage and lead.
No, I mean, I don't have nothing to add. It is already complete.
Yeah, I also agree that the different management models should be maintained. I've been working closely with the WSMTs, and I've realized that some of them are really very efficient. What they actually like is just the enforcement of regulations for local government to ensure that they exercise that oversight responsibility for them to become more efficient in delivering services. Even if there's going to be a utility at the rural areas, I don't think they'll be able to manage all the rural water systems, and we still have to recognize that the community-based management model is a good model. What they need is just an oversight responsibility. In few of the water systems that we are working with, when the DA started auditing them, we've seen that there's a lot of improvement in their financial management, and they are getting enough revenue from the committee members because they are becoming more accountable, and the committee members are supporting them to review tariffs. So I still believe that the trade management model should be context-specific. If in a particular context, community-based management works, then we'll go for it. If it's the public's or utility that works, then we'll go for it. Thank you.
Yeah, I think I was really intrigued by the final kind of reminder that 85% of the systems are still community managed, and I wonder if sometimes we get really excited about what seems new and innovative, but really we need to unpack more what is that supported community management. I think in a lot of places that's become a sort of theoretical support, like yes, the district is supposed to provide, you know, XYZ services to the communities, but I think it's helpful to unpack whether that's really happening and which of these other trends might kind of work well within the community management structures. You could still be doing the training that is a part of professionalization. You could still be doing some of the consolidation with still having community feedback mechanisms. And so sometimes I think siloing the management approaches in this way, calling them, you know, it's exactly this or exactly that, misses some opportunities to draw good pieces into the community management models that exist right now.
Is this working? Yeah, I guess it is. Okay. So I've been following the water problem, I guess, my whole life. I'm an inventor. I invented a new device to drill water wells, and I won the Patents for Humanity Award for that. And what really concerns me is that in 1977, when I first started following the UN and the problem in Africa, there were 300 million people without water, and today we have 400 million people without water. And most of the major charities and USAID and DIV don't accept inventions that improve our chance of overcoming the water problem. So what I'm hoping is that someday USAID or someone else will move forward, not professionalize something that's failing. It has failed. And so we don't need to professionalize something that doesn't work. I'm for professionalization, but I'm opposed to professionalization of failing systems.
Yeah, I think mainly in rural areas, like we are coming and bringing some approaches and bringing we have money for facilities and so on, and we don't ask what is the population willing and the communities willing. And then we have to find the approach that progressively that come in this is the approaches with community-based management that you think that it works or not. We have this other opportunities of other option with professionalization or working in the private sector, and we have some evidence on this working. And we have to have this willing from the communities which are full approach are the best for them, and then it will work surely for they would choose the best one for provincialization, maybe, but if they stay in the other option, we have to find out how what is the support that we need. We have to bring and to make it happen. If it work with the community willing, I think it is the best approach. Thank you.
So I think one of the points I'd like to bring back to this conversation is the issue of water safety. So water safety plans was raised in that panel, and Antoinette put forward that proposition of, is it better to provide higher level services to fewer people or not? Or more services, low-level services to more people. I think one of the things we miss in these conversations is the water quality. So if you look at the water quality that's coming from community-based systems, community-managed systems, you'll find it's very poor. We've got 50% roughly of protected wells are not performing. We assume this is safe, and yet in terms of what we're supposed to be delivering in terms of the human right to water, we're failing on that.
I'll add to that. Strongly agree. I'm Wes Meyer with EOS International, and seeing the water safety plans and the focus on water quality, there's a big gap there. And you know, one thing that we look at is over in Central America, where we're operating, over 80% of the communities we operate in don't have, you know, proper water quality. And I wanted to bring it back to the water results-based funding. And something Andrew said, talking about how it's, you know, the KPIs are very critical, because essentially that's incentivizing service providers to align to and receive funding from. But I'm curious then, who's funding that and who's driving those KPIs, and if that's coming from an external standpoint or even eventually an internal standpoint from a government, how those may change and essentially be effective in driving that change.
I also agree that to improve water quality, the water safety plan is the way to go. For example, in Ghana, we have the urban water supply and the rural water supply. The urban water supply, which is the utility, now has made the water safety plan as a KPI. So what this means is that the PURC, which is the regulatory body for the urban utility, is monitoring to ensure that the water safety plan is implemented in its entirety. But when it comes to the rural sector, where there is lack of regulation as to whether the water safety plan is implemented or not, it is a bit of a challenge. And so once we strengthen the regulation, get someone to monitor the implementation of the water safety plan, I think the quality of water supply to the rural communities will improve dramatically.
I'd be curious to see more evidence around rural water safety planning, because I think there are so many utilities in urban areas that are still at the very starting point. They've developed the plans maybe but aren't implementing them yet, and many urban utilities still don't have water safety plans. So are we expecting community managed systems to go through the full water safety plan process and be able to implement and manage it without a paid staff member? Or is this something we want to start layering in to systems that are maybe already under private management or part of a consolidated or rural utility scheme? I think there's some sequencing in these trends that we have to talk about. You know, what do you have to do to even get to the point where you can kind of jump on the next trend?
Come to our session tomorrow to find out more about water safety plans for rural.
Everyone is welcome to tap in, not just those who we sort of volunteered before. And just a quick pause. We also just offered some ideas here. Do you agree or disagree that evidence shows that decentralization of water supply responsibilities to local authorities improves performance, for example, or that local control and ownership of water supplies is critical to better performing services? And these are questions that were to motivate you, but I know we have Mikaela here. And by the way, UDUMA, I would argue, is among the most significant rural water suppliers in low and middle income countries. Today, they're supplying 2/3 of rural Benin with water supply services, ostensibly profitably. So, welcome to their world.
Thank you for this introduction, Jeff. I would like to answer this question about the water safety planning. As we operate in rural areas, as we have operating models that want to be sustainable and therefore profitable, as we are dealing with communities with very low incomes, we have to remain affordable. So water safety planning is costly. So how do we manage to keep that sustainability, introducing this constraint about the water quality? So far we do, let's be pragmatic here, so far we do testings, we do it once a year. Most of the people say it's too less. Of course it is too less, but before there was nothing. So how do we get to a level where we could reach maybe what is needed for, and what first of all is, how do we make something that is acceptable? Because you have bacteriological, you have physical, there are two different things. They should not be tested on the same frequencies. There are national rules, but they have to go with the national laboratory, which is 600 kilometers from the place you are testing the water. How do we deal with this? How do we introduce these safety management models, or how do we adapt them to the rural realities?
Great. Just to comment on, I agree. How do you get to that level? And I think starting externally and going to the laboratory that's 600 kilometers away, but how do you find the local resources to eventually localize it? So the community is testing their own water, giving the resources available, and adjusting the pattern. So if you're looking at biological every month, every quarter, chemical maybe at a larger scale. But I think it has to eventually keep working towards a local control, so they can actually take that on. That's a challenge though.
I think this gets into a point that was mentioned earlier where a lot of these have preconditions to work. So I think results-based financing is fantastic, but there has to be data management and data collection prior to that. And maybe for better data management, we need more water planning and water safety planning. And that requires a lot of funding, as you mentioned as well. And so I think personally some of the bigger issues is this initial funding and maybe better public-private partnerships at the start. And yeah, I think that's the ultimate precondition might be that government interest buy-in and funding.
So pulling it back to the different management models that we're talking about, and these are emerging trends, you know, if only 15% around the world are using these different models. In the interest of being a bit provocative, which was brought up earlier, so I'm going to challenge my colleagues at Aquaya and also Aguaconsult, where, you know, at the end of this research and we're looking at all these models, you know, if you're sitting in the room and you're maybe a funder or you're an implementer, are we going to be able to look at the results of this and say, okay, you know, here in my context, people keep bringing up context dependent, it's context dependent. Will we know from the end of these results, okay, here I have my context, I have the results from this report or this paper, how do I match my situation to all these different options? And is that something that we'll be able to get out of this, out of these findings? So that's my controversial statement.
Okay, I want to agree that the cost of testing the quality of water is expensive. However, when you look at the water safety plan, it is not doing something new from what the systems are already doing. It's just trying to document and professionalize the existing work. But when it comes to water quality testing, what Ghana we are doing now is to pilot the Water Quality Assurance Fund, where we have a fund involving the District Assembly, Aquaya, a central laboratory system, whereby we try to cluster water systems, share the cost of transportation and other costs to minimize the cost of testing. At the moment, what we are doing is we do monthly water quality tests, looking at some key physical parameters and biological parameters. Initially, these water systems were not testing because they felt that it was very expensive to test. But I can bet you that at the moment, they are able to afford the testing every month. So what we need to do is to put in a mechanism. For example, the Water Quality Assurance Fund, which when well implemented, will be able to facilitate the regular water quality testing.
So I actually came back into this circle because Michael was here. Then as soon as I came in, he stepped out. So I've had a conversation with colleagues over the years about the idea that, and I'm saying idea because we can never find any data to actually show that this is true, but the idea that PPPs work or they have a better chance of success in Francophone countries than they do in places like, you know, the former English colonies, so the former Commonwealth, right? And the observation that governments in Commonwealth countries just get nervous when you start talking about taking away public services from the government and, you know, placing it in the hands of a public company like UDUMA, whether it involves them or not, but just the idea gets them very nervous. And I was just wondering if anybody else has found this to be true. And when Michael was listing the countries that UDUMA operates in, I was like, oh, that's all Francophone Africa. And I was like, I wonder if he's intentionally avoiding the rest of the countries because of this observation. And I wonder if that's actually true. And maybe the folks who are familiar with the work that Aguaconsult was doing might actually have an answer to this, because they had a sample that included English-speaking and French-speaking countries. So maybe they're able to make that comparison of, is it even worth trying PPPs in English-speaking countries or in English-speaking Africa, or is it too much of an uphill climb?
Okay, I can answer the first part of your question. Well, I work in Ghana, and I can tell you that we have successful methods with forward development doing similar to what UDUMA is doing in Francophone countries in an Anglophone country. That's the first part of the question. However, on the same line of being provocative, we go back to the dichotomy of water as a human right, or do we have to pay for water quality? After so many years of experience, everything comes down to water tariffs, and also about the legal framework. When we talk about private sector engagement, when we talk about PPPs or private professionalization, if there's no money to pay, nothing is sustainable. And we can continue to talk about sustainability, but if the people are not willing to pay, or what they are paying is not enough to sustain, this is not sustainable. So I think we're on the right path. I think we are creating that willingness to pay, people understanding that they pay for the convenience to have the water delivered to their homes. That's a value added, and but also we have to find an equilibrium between what is fair to pay, but also to have a tariff that is good enough to incentivize private sector and other players to come into the sector. That's my contribution.
This will be our last tap in, because we're going to be running out of time. So.
You were here
Okay, thank you. I was provoked by the mention of Anglophone and government. I come from Uganda, and I work with the government, with the Ministry of Water and Environment. And yeah, we are pleased to have Aquaya work in Uganda in some regions. I want to disagree with the person I replaced here, what he said about the governments in Anglophone countries not being willing to adopt PPPs. I think we need to look at where do we want to adopt the PPPs? Is it infrastructure or for the soft service, for say management? If it is infrastructure development, I think even in the Anglophone countries, governments are willing. And I want to relate that to what was said here, because for the infrastructure, and then we also have to differentiate between the large water supplies and the point water sources. If you invest in infrastructure in the urban areas, in the piped water, there's willingness to pay. But I think in some of our countries where the majority of the people live in the rural areas and they are served using point water sources, then some of these approaches may really not work. Because even for management, I'm not sure, I came late, I don't know whether Aquaya presented this, but even for management purposes, if, say, a hand pump breaks down, it's really difficult to get the communities to contribute to pay for the repair of O&M. So really it depends on what we are talking about. Is it large water supplies, or these small point water supplies that are dotted everywhere and serving a number of people and not taking the service to the premises? So we need to distinguish. And then we understand the level of whether government is willing or whether people are willing to pay. The other thing that tickled me is the mention of water safety plans. I don't know who is from Iowa here, and I wanted to ask if we are really objective and honest to ourselves, why has it taken water safety plans so many years, I think over 20 years, but the uptake is very poor? Honestly, the uptake of water safety plans is very poor, at least where I come from in the developing countries. We talk about water safety planning in the, for the large water supplies in the urban areas, but what Iowa is calling community water supplies do not exist in some parts in developing countries. Because when you're talking about small water supplies, you're still talking about piped water supplies in small communities in the developed areas. But when you talk about small water supplies in the developing countries, then we are talking about these point water sources, the wells that are not piped to any household. So how are you going to apply water safety plans to these point water sources? And I think that's the honest question. Iowa and all of us who are interested in water quality management really need to ask ourselves, how are we going to implement or really scale up water safety planning to these point water sources? Thank you.
That's the kind of provocative question we want. So the last three quick
Yeah.
ones, please.
Yeah, I think I agree with you. When it comes to tariffs, equity plays a big role. And I think as we discussed this, I was very much interested in the information that our colleague from USAID shared about on-premises. We have about 1 billion people living in informal settlements. These people pay several folds of the amount that is charged to those in the places where access is being provided. And yet, these people could have contributed to the tariffs that is required to safely operate and maintain the services. So if we talk about tariffs, we have to look at how do we even increase access to these informal settlers who are there and not having access. Yet they are paying several times the amount of money that is given as bills or utilities to those who are in the other side where services are provided. So I wanted to ask maybe the colleague from USAID, maybe his experience in Zambia. How did it work in the informal settlements, like the slums, who are actually really in need of these services? They are paying several times that maybe the middle level groups are paying, and yet they do not have. Was there anything that you saw different when you were there? And is there anything USAID is making, consciously to help address this gap? Thank you.
Yeah, thank you for the question. My personal experience in Zambia was specifically in rural areas, so while I acknowledge that the urban slum question is a very good one, I don't have any personal experience to contribute there. Regarding USAID's programming, yes, a lot of our water work particularly goes to rural areas and rural investment. There is a segment of our work, depending on the context, that is focused on urban communities, and perhaps we can connect that to the segment.
Yeah, we're going over time, so last quick ones, and then...
Okay, thank you. My name is on water safety planning. Yes, it is true, water safety planning is capital intensive, but we can maximize the investment on water safety planning. Like, it is not a standalone. Water safety planning is a right tool, especially in rural areas, to engage communities just by promoting household sanitation, by promoting catchment management or water resource management, by promoting improved water supply services for which community has to pay. So if we pull all these together, really we can maximize the investment on water safety planning. But if we consider only a point source and go for water safety planning, it is not really cost effective. Thank you.
I just wanted to respond to the legal question. I'm not a lawyer, but I know that we once asked a very clever lawyer at the World Bank, and apparently the difference is because British law is based on case. You can challenge by case, and that makes it a little less secure, whereas Francophone law is based on the French system, which is the law and it can't be changed. So that's one difference. But going back to the person who was sat here before, who asked what will the results of these studies do in terms of informing decisions, I think it's not us really, it's government who need to be the ones who take those decisions. So all we can do is put out the evidence, help inform that debate, and those debates are ongoing. The policy cycles are different in different countries. So really, it's the governments that are the people that should be then leading this process. And from the discussions we had yesterday in a discussion on professionalization, that was clearly the case. So I think all of this work will feed into those efforts, but we shouldn't forget that it's not us, it's governments, who I think are in the room as well.
Thank you everybody for
Thank you so much.